Now, in summarizing, let me emphasize again that adopted and foster children are at risk for a variety of mental health problems and learning problems. They are affected by many different factors, and these problems are a result of many different factors, not a single factor. The factors occur both pre-placement, genetics, prenatal experiences, pre-placement experiences, as well as once the child is in the adoptive family, in the post-placement years. The more serious problems of adopted and foster children, though, have little to do with being adopted per se, but with those factors impacting on them prior to being placed. As I said, genetics, prenatal experiences, and pre-placement adversities. But the dynamics of adoptive family life and foster family life do play an important role in the ongoing adjustment of children. It informs their identity. It influences parent-child relationships. As clinicians, we need to be able to help parents to understand how being adopted, how being part of the foster system is impacted on their child, and help them to be able to manage these issues to enhance the child's emotional well-being. Let me end this course with talking with you a little bit about becoming an adoption competent therapist. Most therapists, especially those who work with children and with families, will find themselves, at times anyway, working with adoptive families. As we've seen in this course, these families often confront a host of challenges. They're adopting older children, children from orphanages, children who come from different cultures, speak different languages. They are children who've experienced early trauma. They have attachment issues. They have this pervasive sense of loss in their life. Oftentimes there are transracial and transethnic issues to be dealt with. These challenges pose significant complexity for the clinician working with adoptees and their parents. To work effectively with their adoptive clients, clinicians need to be adoption competent. Far too many adoptive parents and adult adoptees who I've worked with report that their experiences with the mental health professionals have been unsatisfying and, frankly, sometimes counterproductive, because the therapist, in their view, did not really understand or adequately address the way in which adoption or the pre-placement issues impacted on family members. Sometimes these issues are just ignored by clinicians, with little effort to explore the meaning and implications for parents and children. But sometimes they're overemphasized, with adoption being a lens, the primary lens through which the clinician views the family. There is research showing that clinicians often have a negative attributional bias once they know the child is adopted. All you have to do is to insert the word adoption in the description of the family, and clinicians often have more negative views about the child, diagnose in ways that reflect a negative bias, and in fact actually recommend more intensive services. And that's just because of the label being used. Adoption competency is about having the knowledge, the skills, the clinical tools, the values, and the sensitivities that allow the therapist to understand and effectively integrate adoption issues into the assessment and the intervention processes. This course has been a first step toward becoming adoption competent. But I would encourage you to take the next steps, which would include continuation in CE courses dealing with adoption. I would also suggest that you explore the emerging adoption certification programs that are developing around the country. And I just want to mention two of them. There are about 8 or 9 of them now around the country. One has been developed by the Center for Adoption Support and Education in Maryland, run by a woman named Debbie Riley. And the second is a program developed by the St. Louis Psychoanalytic Institute in St. Louis, of course. These programs offer comprehensive training in adoption issues and clinical interventions directed to adoptive families in particular. And finally, I would urge you to seek out and utilize clinical supervisors when you are unsure about adoption-related issues in your practice, when you aren't sure how to proceed, when you don't understand how something ties in, an adoption issue ties into the child's dynamics. Utilizing this type of a supervisor will help you to become a more effective clinician with these families. I want to thank you and let you know that if you want to, I'd like to get some feedback from you on the course. And if there is any information that you would like from me or would like to seek a clinical consultation with me, this is my contact information at dbrodzinski@adoptioninstitute.org.